What is known about the effects of alcohol use by the biological father before conception?
So our understanding of how the biological father affects his sperm is changing in our understanding. We've always understood that somebody who drinks heavily can affect sperm production and that there can be genetic changes on that. But we never realised or knew that there were specific areas that were at risk. The evidence that is changing now is that there may be vulnerabilities in specific areas of the genome to alcohol, which can be affected, that can be measured and transferred on. So it's certainly passing on a vulnerability. Whether or not that actually leads to outcomes that are measurable is still unclear. And also gets even more complicated because obviously somebody who is highly sexually active is going to use the sperm up much more rapidly than somebody who isn't. Sperm is produced roughly 20 days up to beforehand and stored. And so effectively, there's so many complicated factors as to when you drink, how it affects the sperm, how that's passed on, the vulnerability that leads to in the child, that all we know is, yes, there is a potential genetic factor that can be passed on to the child that makes them more vulnerable to the effects of alcohol and how the mother drinks as well, and the combined effect is more significant than one partner alone drinking. But it's very early days and this evidence is growing. What people would generally say is a reproductive health issue of both mother and father biologically. If you're thinking about having healthy children from both sides, whilst you're in that preconception stage, it's probably better to avoid alcohol.